This is the local hospital. I wonder how they are affected by Obamacare.
This individual mandate, which says everyone owning a Ford insurance has to buy it. The reason for this rule is some of the reforms that went against the insurance companies, namely end of discrimination against people with pre-existing conditions and caps on lifetime and yearly expenses. What this means is, right now, health insurance companies can deny you coverage if you are already sick. If you have a major disease such as cancer, they're not likely to offer you coverage because you'll cost them a lot of money. Furthermore, if you already have insurance, they can put caps on how much you spend in a year. Now, the new healthcare law makes these programs illegal. The insurance companies can't do that anymore. But that is bad for their bottom line. That will run some insurance companies, most of them, out of business. So the trade-off is they instituted the individual mandate, which says everyone that can afford insurance has to buy it. So now the risk is spread amongst healthy and sick individuals. Now, a lot of people are worried about how are they going to afford insurance. Poor people. A lot of people want insurance, they just can't afford it. Well, the law, it factors that in.
So, what he's saying is true, that Obamacare supposedly makes insurance cheaper, though it's far cheaper to just pay the fine. It's way cheaper than actual insurance. So, and since you can't be denied insurance under Obamacare, you can just get it once you become deathly ill or once you find out you have a disease such as diabetes. The same is true for employers. They don't have to pay their employees health insurance anymore. They can just pay a fine, which is far cheaper. So most likely, many employers are going to drop the insurance that they give to their employees in the future. I wonder what this guy thinks. That breeze. So healthcare started in 1920s. It wasn't needed prior to that because remedies came cheap and doctors were inexperienced. But as new diseases were discovered and more expensive equipment needed to properly treat people, there came a need for health insurance. Unfortunately, it covers things that you don't really need to be covered, like daily visits, which slightly makes it more expensive on its own. But also, the price of health insurance has increased due to the suing of doctors. They pay their own insurance, so in order to cover the costs of rising insurance on their part for malpractice, they raise the cost of their services.